All right, now tuberculosis remains a threat in the country, with counties like Nairobi, Meru and Kiambu rated as high burden by the Ministry of Health in the National TB Council report of 2021. Among issues that hinder eradication of this disease are late screening and diagnosis, as well as patient adherence to drugs. And as Emily Chebet reports, new measures in Kiambu North sub-county in Meru have improved the cure rate of TB patients in the region. Among them, the Gene Expert and X-ray machines donated by the Ministry of Health through Center for Health Solutions. These machines have enabled early detection and proper follow-up.
Peter Muroki makes his 23rd visit to Mutwati Sub-County Hospital in Kiambu North Meru County. He is being treated for tuberculosis in this facility for the last 5 months. TB treatment takes a total of 6 consecutive months, and in most cases, patients are given the entire regimen, while others get drugs that will last them up to 3 months. According to Dr. Titus Mutura, the medical superintendent at this facility, patients like Peter have been forced to visit the hospital every week due to poor level of adherence to medication.
You realize that this patient has not come. So this linkage assistant, with the help of the CHV, will go to look for that patient. So we have every box named after a patient. Instead of giving them drugs for 6 months, because sometimes they will not come back, they will go and throw drugs away. Some go and take drugs for 1 month. After that, they feel, okay, I'm feeling good now. They throw the drugs away.
Peter first experienced symptoms of TB in February this year, and because he was not aware that those symptoms were actually of TB, he sought over-the-counter medication. He later decided to visit the facility when those symptoms failed to go away. Dr. Mutura says Peter was lucky he did not develop drug-resistant TB, a complicated condition that is as a result of misuse of drugs and especially antibiotics.
Nilisikia ninakoa na usiku na kutetemeka usiku na kuota ndoto mbaya mbaya. Nikasikia tu aje nipimwe.
Sometimes you get a cough, you go to a normal clinic and you are treated. You know they treat and the symptoms will go down. You go again and get treated. Again it goes down depending on your immunity. So when you come to the hospital, the antibiotics that you have consumed have already created resistance in your body. So the treatment becomes very difficult.
It is a tedious everyday visit by Peter and other patients, but one that they acknowledge is important towards their full recovery.
Nimekuja ndao kwa miezi 5 na siku 20 saa hii.
Vile nisikia ni kutembea kama mahali pale kwa stage, nasikia uzito kwa kifua. Siwezi tembea, hata nikitembea napumua tu.
10 days to go for Peter to finish his TB dose. For Faith, 2 weeks to complete her medication regimen. The two, however, says they are feeling much better, having lost weight and energy prior to the medication. Proper nutrition remains a challenge to a few who cannot afford a meal due to the tough economic times. Duncan Barkebo, Upper Eastern Regional Officer representing Center for Solution Health in the USAID TB Act 2 project, says the government has been providing food for the most vulnerable TB patients, but more needs to be done.
Mimi niliendelea kukula kila kitu niliambiwa nikule. Nikaendelea kukula ile inaitwa mboga. Nikaendelea kutumia ile inaitwa fruti. Yote vitamini yote. Mimi natumia kwa mwili yangu. Yote nikasikia afya inakuwa mzuri, inaendelea kuwa mzuri.
Najua aliniambia hata niwe nanunua uji, mimi nameza ndawa na maji. Hadi chakula waliniandikia, mimi sipati, mimi ni asura.
County governments and the government in general and even partners need to really focus and see how they can collaborate with other departments to even have the food rations through the other line ministries, so that these TB patients can actually benefit from food support given to the patients.
The availability of Gene Expert and X-ray machine provided by the Ministry of Health in this facility has led to early screening and diagnosis of TB patients. Dr. Mutura adding that the use of community volunteers has accelerated the identification of missing cases in the community and easy follow-up of patients who are reluctant to complete their medication. This has improved on patients' cure rate.
Nikienda uko mahali natembea, nikiona mwingine ako na kifua kama hiyo, namletanga hospitali. Nimezeleta watu zaidi ya 10.
From that 3% in 2017, in 2021, we reached 91%, which was a record, because in 2017, actually, we were, in the country, we were number 273 out of 278.
After the doctor's appointment, Peter heads back to the village. It is time for him to swallow his medicine before going on with his normal duties. He is one of the success stories of those who have kept their diary with TB medication. TB still remains a challenge in the community, and here in Igembe North Sub-County, efforts to eradicate this disease is bearing fruit after 91% cure rate has been recorded so far.
The TB medication is a journey. It is not a one-week course medication.
As we leave this village, Peter is optimistic that in 10 days, he will be free from one of the most infectious diseases. And that in between these hills, he can be able to reach more people to get tested in order to push the cure rate to 100%. The efforts in this sub-county, part of the many gearing towards eradication of TB in the country by 2030. Emily Chebet, Citizen TV, Igembe North in Meru County.
Some good news.